this is an Indigenous food as medicine intervention, and we know there are very high rates of food insecurity among many Indigenous populations in the United States. And with that, there's also increased focus and momentum in many Native communities to reclaim traditional pre-contact foods to improve health. So, in partnership with community members, we designed MUTTON HF, which is a locally sourced, culturally and medically tailored meal program incorporating traditional Navajo foods and recipes. And so for the MUTTON HF study, the study was designed to test the hypothesis that this Indigenous, culturally and medically tailored meal program would lead to a lower incidence of hospitalizations and ER visits among patients with heart failure in rural Navajo Nation. We had some very exciting results. Our primary outcome of interest, as mentioned, was the rate of hospitalizations and ER visits at 90 days, which we found to be significantly lower in those randomized to the intervention arm, with a relative risk of about 0.72, so almost 30% lower in the intervention group. That was really driven by a difference in hospitalizations. So hospitalizations were lower in the intervention group, as well as hospitalizations for heart failure specifically. And then we also found really notable improvements in many patient-reported outcomes. So this included improved food security status, improved symptoms and health status measured by the KCCQ score, particularly the physical and social limitation subscores. We also found reduced financial strain, reduced weight with a between group difference of negative 6.3 pounds, as well as improved blood pressure with differences of about -7 and -3 for systolic and blood pressure, diastolic blood pressure respectively. So overall, some very promising results. So we found those in the intervention arm did have improved intake of fruits and vegetables as predicted by providing these meals. And then as mentioned, the main outcomes that we found, the primary outcome of interest, the proportion of patients with a hospitalization or ER visit at 90 days was significantly lower in the intervention arm as compared to the control at 40.6 versus 57%, which is statistically significant. This is really driven by that difference in hospitalizations as well as heart failure hospitalizations as well. So this was a program that was designed with community partners, with patient providers to really align with community priorities. And so I think that's a really important component is community engaged design. And so for this meal program, we partnered with a local dietitian to design meals that incorporated traditional Navajo foods and recipes. We also locally sourced the meals with local produce and meat from local Navajo farmers and ranchers, designed the meals, made the meals with a native-run kitchen that's located locally to us. And then another key component was we provided appliances for patients to participate, such as fridges and mini fridges, including propane-powered appliances for those without electricity. And so I think all that together, there's a lot to be learned in terms of what might benefit in terms of these programs. And the key considerations are really that community engaged design, building these strong partnerships and alliances, and really centering community and community voices in the design of these interventions. And then I think it's really notable that MUTTON is a strength-based intervention, so leveraging the protective assets of Native communities is really paramount to improving Indigenous holistic health.